In a quiet hospital room, a brilliant scientist receives a terminal cancer diagnosis with only months to live. Studies show 20% of terminal patients experience acute existential distress initially. The doctor's prognosis, stage 4 pancreatic cancer with 6 months survival, echoes Steve Jobs' 2003 diagnosis. Medical reports show tumors have metastasized, yet cognitive functions remain intact, presenting a cruel paradox of sharp mind in failing body. Research indicates 68% of terminal patients reframe their perspective within 2 weeks. Our protagonist creates a legacy list, not a bucket list. Neuroscience shows such planning activates the prefrontal cortex, reducing anxiety. She calculates 180 days means 4,320 hours. Allocating 8 hours daily for treatment leaves 2,880 productive hours. The ticking clock becomes a motivator, not a threat. As studies show, time pressure enhances creative output by 23%. Analyzing global issues, she identifies cancer research funding gaps. Only 4.7% of NIH budget targets pancreatic cancer, despite its 93% mortality rate. Her academic background reveals a solvable problem: lack of collaborative platforms for researchers. Data shows open source projects advance 40% faster. She drafts Project Phoenix, a crowdsourced research portal, inspired by MIT's OpenCourseWare, which has reached 500 million learners since 2001. Psychology research confirms storytelling increases donation likelihood by 300%. Her TEDx talk, recorded during chemo, goes viral with 5 million views in a week. The vulnerability paradox works. Her visible IV line increases authenticity. 1,200 researchers sign up within 48 hours. Baylor University studies show such community building reduces patient depression scores by 38%. Her husband becomes CTO, adapting agile development methods from this tech background. Despite 30% weight loss and neuropathy, she leads daily virtual hackathons. Johns Hopkins research confirms cognitive work doesn't accelerate cancer progression. The team develops AI tools to analyze 50,000 research papers, identifying 127 promising compounds. Pain management follows Memorial Sloan Kettering's protocol: short work bursts with 20-minute rest periods. Remarkably, her white blood cell count stabilizes, a phenomenon documented in 12% of engaged terminal patients. Nature Journal features Project Phoenix, citing its unprecedented 72-hour peer review system. The platform now hosts 15,000 researchers across 83 countries. Data shows a 60% increase in pancreatic cancer paper submissions. Bill Gates Foundation pledges $20 million, noting its similarity to early open-source software movements. Meanwhile, her Change.org petition for research reform gathers 2.3 million signatures, forcing congressional hearings, proof that terminal patients can drive policy change. On day 147, the platform's AI identifies a novel biomarker combination with 89% early detection accuracy, potentially saving 30,000 lives annually. She insists on publishing open access, contrary to her institution's patent policy. Research shows open medical innovations reach clinical use 5 years faster. Though now requiring oxygen support, she finalizes governance protocols ensuring project continuity, applying lessons from Wikipedia's 2001 success. In her final week, she records video lessons for the next generation. Palliative care research shows legacy projects reduce end-of-life distress by 41%. Over 500 researchers worldwide hold simultaneous vigils. Her last act, signing the Open COVID Pledge, ensuring any derivative work fights pandemics. The death certificate lists pancreatic cancer, but her legacy metrics show 42,000 researchers registered, 1,200 collaborations formed, and 17 ongoing clinical trials. Posthumously, Project Phoenix becomes standard infrastructure at 18 cancer centers. Data shows a 300% increase in pancreatic cancer research output. Her governance model is adopted by the NIH's 2025 Open Science Initiative. The platform's AI now assists with breast and lung cancers too. Memorials at MIT and Oxford feature her mantra, "Deadlines shouldn't limit dreams." Remarkably, 7% of participating researchers changed fields to continue her work. 5 years later, her story sparks the legacy movement. 620 terminal patients have launched impactful projects. Stanford studies show these initiatives create $2.8 billion annual societal value. A young researcher, inspired at age 14 by her TED Talk, now leads a team developing early detection nanotech. Her biography becomes required reading at medical schools, proving that mortality certainty can fuel immortality of impact, the ultimate validation of a life well lived.